I'm Hannah Needham.
And I'm Kirsten Cummings.
And we're from the Cascade FFA chapter. Today we will be demonstrating different types of sheep dystocia. The sheep industry is growing as we all know it. Whether that be the club lamb or commercial sheep operations, there are very many problems that may occur. A widespread problem is known as sheep dystocia, or difficult birth. Today, Kirsten and I will be demonstrating 7 different ways a ewe in labor can deliver her lambs, the good and the bad. First things first, there are a few key behavioral changes.
First, ewes will engage in nesting, separating themselves from the flock, grinding their teeth, straining, and just acting nervous and uncomfortable. The whole breathing process will last between 2 to 15 hours, and producers will have approximately 40 to 60 minutes after the appearance of the water sac before the lamb is born.
Keys to successful lambing. Number 1, you always want to be working in a clean workplace and minimize the amount of infections that may occur.
Next, you're going to want to be patient with the birthing process because rushing the job can lead to further complications.
And number 3 is the most important. You want to have an imagination. Whenever you're going in to check a ewe, you want to make sure you know what's coming out first and make sure that none of the lambs are tangled together.
Before we start, you're going to want to have some supplies. You're going to want to have your surgical gloves or sleeves, Survive, which is a vitamin E and energy supplement, and then lube, which will also serve as an antiseptic to further help minimize the introduction of infections.
Another thing you always want to have on hand is an unscented towel. A scented towel may cause a ewe to orphan her lambs.
In stage 1, there will be uneasiness, kicking, pawing at the ground, lying down, and getting up frequently. This stage will typically last between 1 to 8 hours and ends with the introduction of fetal parts into the birth canal.
Stage 2 is when there are visible signs of labor. This is when a lamb's feet or head are coming out first. This lasts between 15 to 30 minutes per lamb.
After the birth of the lamb, stage 3 is when the placenta will be passed. It will be passed approximately 15 to 20 minutes after the birth of the lambs, and the ewe may consume the placenta, which is rich in the hormone oxytocin and aids in milk letdown.
Some types of dystocia that we will be demonstrating to you today is normal presentation, which isn't a type of dystocia, but it's the way you want the lambs to come out. Another type is backwards, one leg back, the head back. When there's a set of twins with 4 legs and 1 head, and when there's a set of twins when there's 1 backwards and 1 forward.
Some causes of dystocia can include extra large lambs, twins coming out at the same time, the size of the ewe's pelvis and birth canal, as well as a ewe's failure to dilate prior to birthing. So our first presentation or position we will be showing you is the normal presentation. Before you start, you're going to want to gather all those supplies and get them ready. As you can see, Hannah is putting the shoulder-length arm sleeve on her dominant hand and another regular hand glove on the other. So in the normal presentation, this is the way that you want lambs to come out. This is the proper way, and usually ewes won't need any assistance in this position. However, if assistance is needed, you're going to want to apply a firm, steady, gentle grip on the lamb, and then steadily pull the rest of the lamb out.
Making sure once the lamb is out to wipe off its nose and airways so that it can breathe.
The next position we have is elbows locked. This is when the elbows of the lamb are locked in the pelvis and they are facing downwards. In this position, you will usually see the 2 tips of the hooves and the mouth right next to each other, which is not supposed to happen. In this position, you're going to want to gently push the lamb back into the womb of the ewe and then pull each of the legs forward one at a time. Once the lamb's in the normal presentation position, you can continue to pull the rest of the lamb out. Our next position we have is 1 leg back. In this position, if the lambs are smaller and the ewe has had multiple sets before, she may not need any help. But in the instance that she does, you're going to want to reach your hand into the ewe, sliding your hand gently along the shoulder of the lamb, and then grab the hoof or foot that's turned backwards, making sure to keep it in your palm of your hand to protect the wall of the birth canal, and then pull that backwards leg forward into the normal presentation and pull the rest of the lamb out like so.
Another type of dystocia that Kirsten will be demonstrating to you today is when the head is back. This is when the 2 front legs are coming out and the head is turned around towards the ewe's head. This can be caused by when there's a small pelvis and the ewe fails to dilate. As Kirsten gets ready, the first thing you want to do is go in and make sure you know what's coming out first, whether that be the head or the legs. In this situation, it's the legs. Proceed by gently pushing the lamb back into the uterus. Move your hand up and feel for the head and turn it around so that it's coming out in the normal presentation. And then you want to gently pull the lamb out. The next type of dystocia is when there's a backwards lamb coming out. Normally, the ewe may not need help, but in some instances, they can need help. When working on this ewe, you want to go in and make sure that you know you have 2 back feet. When you know you have the 2 back feet, go ahead and apply a steady, firm grip on the back legs, gently pulling up until the lamb's pelvis is out and then pull down. If you pull down too quickly, you can wedge the lamb into the ewe's pelvis. The next kind of dystocia that Kirsten will be demonstrating is when there are twins, when there's a front and a back one. This is not uncommon in sheep. Before making any sudden moves, you want to go in and make sure that you know she's having twins and you have 4 legs and 1 head. First, push the lamb that is backwards up towards the ewe's head and pull the lamb that's in the normal presentation out, being sure to wipe off its nose and airways. Once you have that lamb out, go ahead and go in for the second lamb, making sure that both back legs are coming out. Gently pull up with the lamb's legs and then pull down once the pelvis is out. Now this next type of dystocia is a sticky situation. This is when there are 4 legs and 1 head. Oftentimes this may take a little while to figure it out. If they are both coming out like the picture shows, gently push both lambs back to allow enough space for one of the lambs to come out. Normally, the lamb that's in the normal presentation, that has its head coming out, is the one you want to pull out first. Before pulling, make sure you have both legs that apply to the same head. Once you figure that out, go ahead and gently pull the lamb out. Acting quickly, go ahead and go in for the second twin and turn that head around so it's coming out the right way into a normal presentation. And go ahead and pull out.
So some common mistakes made by inexperienced producers or shepherds in the sheep industry would be allowing the mothers to be in labor for too long. To prevent this, you're going to want to check the progress of ewes often within those crucial hours of birthing. Another common problem is trying to intervene and deliver or fix the problem without correctly identifying it first. And then another mistake is with twins pulling limbs that might not belong to the same lamb, like for instance if you're pulling the arm of one and then the leg of the other, can just lead you to more harm than good.
It's important to do aftercare on the ewe and the lambs, making sure that the milk ducts are clear on the ewe so that the lambs can get up and start nursing. It's also important to make sure that the ewe has passed her afterbirth, whether she eats that, which releases oxytocin, or whether she's up and licking off her lambs. If there's any more bleeding occurs than necessary, it's important to contact your veterinarian. In conclusion, today Kirsten and I have gone over 7 ways a ewe in labor can deliver her lamb, keys to successful lambing, aftercare, and the stages of lambing. While there are many things we can't do to prevent these problems, there are many things we can do to lower the mortality rate. Thank you.